Hey everybody, welcome back. My name is Dr. Samantha and I am the maternity mentor. And we're back again for another Monday live Q&A session where we go ahead and we take some of the questions that you guys have submitted on some of our videos and we answer them for you here. Remember, we're putting out videos usually every Tuesday. Please feel free to follow us on Instagram, Twitter, and Facebook for additional content. And remember to share our channel with your friends and family. So I'm going to go ahead and get started. And remember, for any of you guys joining us today, if you have any questions, please feel free to put them in the chat. Good morning. Welcome back. I'm going to go ahead and start with our first question. This question is about antibiotics. And we get a lot of questions about antibiotics because it's so important. I'm 4 weeks pregnant and I've had a cold and cough for 5 days. The doctor gave me cephalexin. Is it safe for the baby? So it's important to understand that when you're given antibiotics, that means that your doctor has determined that you have an infection that needs to be treated. The reason why it's so important to treat infections during pregnancy is because infections that are left untreated can lead to preterm labor, miscarriage, or stillbirth. So you want to make sure that that infection is treated because it can also put your life in danger if it becomes systemic. That means if it goes through your whole body. Now, antibiotics are very interesting because after a day or two of taking them, you're going to start to feel better. In fact, you may feel completely better. But antibiotics are usually prescribed for 5 to 7 days. And that's because even though you're feeling better, you still have a lot of bacteria in your body. So you want to make sure you take the entire course of the antibiotics because if you don't, the bacteria that are left, they're going to be able to build resistance or like a barrier against the medication. And then when you get sick again, and you most likely will in about a week, your doctor can't prescribe the same antibiotic. Your doctor tries to prescribe antibiotics first that are safer, which means they're more mild so that they're okay for the baby. But if you continue to have a treatment-resistant bacterial infection that doesn't respond to those mild antibiotics, now they have to use stronger and stronger medications, which may not be as good for the baby. In this case, the mom is asking, is cephalexin safe to use during pregnancy? And the answer is yes. Cephalexin is a safe antibiotic to use for infection during pregnancy. So that's a great question. All right. So our next couple questions are going to be about bleeding because we get a lot of questions about that because bleeding is very scary during pregnancy. So is it okay to bleed when you have sex with your partner and you are 1 month pregnant? Is the baby still okay? So this is a complicated question. So the first thing you guys need to know about bleeding is any bleeding whatsoever needs to be reported to your healthcare provider. Bleeding can look bright red, it can be pink, or it can be brown. Brown is old blood, okay? But it's still important that you report it because we want to figure out what caused that bleeding, okay? Now, it is potentially normal to have some bleeding or spotting after having sex with your partner. That's because the hormones that are needed to maintain a healthy pregnancy thin and dry out the vaginal tissue. So what happens is when you have sex, even with good lubrication, that tissue can tear a little bit and cause some spotting. That being said, you always want to let your healthcare provider know what's going on because they may want to do some testing to determine if that's the case. Now, the second part of this question that's interesting is this person describes their pregnancy as 1 month along. So at 1 month, another cause of bleeding could be implantation bleeding. So most of the time, we don't know the exact date we got pregnant. So we can only assume that we know when conception happened. But the thing is that at 1 month, you actually may only be 2 or 3 weeks pregnant. At the time that you end up having a fertilized egg, it needs to implant into the uterine wall. And when that happens, that's when the baby attaches to the uterus. When that happens, that is called implantation. And a little bit of the uterus can shed some blood, and that's what you see as bleeding. Again, it's very important to tell your healthcare provider because they may want to do an ultrasound to confirm the cause of the bleeding. Now, the other thing I want to say about this is sex. Sex is, generally speaking, safe and healthy and good for you during pregnancy. It's important for you to be able to connect with your partner during this time because it's a very special time. However, you want to follow your healthcare provider's advice. So if your healthcare provider is telling you not to have sex, it's important that you follow those guidelines because something could be going on. Now, in addition to talking about sex, we need to talk about a little bit about what that means. So traditionally, when we think of sex, we think about a penis entering a vagina. However, there are other parts of sex that we may enjoy. For example, we may enjoy fingers or toys inside the vagina. We may also enjoy anal sex, and we may also enjoy just foreplay that leads to orgasm. If your healthcare provider says no sex, you need to clarify what that means because they may just assume that you're just going to abstain from everything, and you still may be allowed to do certain things. So make sure you ask your healthcare provider, what does that look like and how long is it going to last for? All right. Our next question about bleeding is, I gave birth 16 days ago and I'm still bleeding. It stops for 2 days and then comes back, but very light. Is that normal? Okay. So this is a mom who's had a baby. So she's postpartum and she's 16 days out and she says she's still bleeding. It happens for a couple days and then it stops and it comes back, but it's very light. So yes, that is very possibly normal. So bleeding postpartum goes from a really bright red right after you give birth that's very, very, very heavy with lots of clots. And the first 2 to 3 hours, you're bleeding the most. Then over the next 3 days, you are moved to like a postpartum unit usually where they monitor you, or you're being monitored at home and taken care of hopefully by your family. And during that time, you may bleed so heavy that it's like a heavy period. But after 3 days postpartum, your bleeding should start to decrease slowly. Women can bleed for up to 6 weeks after having the baby. The blood usually goes from a bright red to a dark red to a dark pink to a light pink to like a clear. Okay. Now, if you had light pink and it goes back to dark red, that's a very serious issue and you need to contact your healthcare provider immediately. However, in the case of this mom, if she's talking about going from light pink to no real discharge to light pink, that's probably just a little bit of her body cycling through the rest of that blood. And so what you want to look out for is if you start to get a fever, chills, if you get hard pains in your stomach, or if you're just generally speaking not feeling well, or again, if the blood starts getting heavier and darker, you want to contact your healthcare provider. Otherwise, that sounds pretty normal. All right. I gave birth to a premature baby 5 months ago. I had my period in early November. However, I missed my period February and March. On the 14th, I had spotted light blood, just a little bit, but this went on for 3 weeks. However, I do not have any pain or feel sick. What could be the cause? So it sounds like this could be a possible miscarriage, but the best thing to do would be to take a pregnancy test because I don't see that that's mentioned here. When you've had a baby 5 months ago, it is very likely that your cycle has returned to normal and you're saying you got your period. So if you miss 2 periods, you need to make sure that you check yourself for pregnancy. Now, if you find that if you haven't had sex, if it's not possible for you to have conceived, you need to go ahead and contact your healthcare provider because they're going to want to do an ultrasound to determine the cause. Okay. So that's a really good question. All right. So I see a question in the chat. Patient with lower abdominal pain. What could be the possible differential? I'm just looking at the other stuff. So if the patient is pregnant and she has lower abdominal pain, I would say a couple things. So if it's lower right abdominal pain, that could be appendicitis. And that's very hard to diagnose during pregnancy because one of the most common things you would do is an ultrasound. And depending on how far along she is, the uterus comes up very quickly, even if the belly isn't showing on the outside, and covers up a lot of the lower abdomen. Another thing that's very common in pregnancy is constipation. This is why we often have moms complaining of hemorrhoids. And we have a video on hemorrhoids that we can link into the chat box for you guys. But what happens is everything slows down and you have a baby that kind of sits on the intestines, which slows down how much the belly's really moving. And then mom's tired, so she may not walk around as much while she's pregnant. And a lot of women don't drink enough because they're so worried about going to the bathroom all the time. This is the perfect storm for constipation. When we have constipation, a lot of moms will complain of lower abdominal pain because they feel like trapped gas and stuff that won't come out. And then the other thing that I would imagine, depending on the location of pain, is actually like round ligament pain. Okay, so you have your uterus and you have fallopian tubes and you have ovaries. And the ovaries are connected to the inside of your body with these ligaments, okay, kind of like ropes. And what happens is as the uterus gets bigger and heavier, those ligaments, those ropes that are kind of holding everything in place, they get stretched. And so women will often describe that as a sharp stabbing pain. And it's unfortunate because it's absolutely normal and there's not much they can do about it. And we actually have a video on that. So we'll link that in the description or in the chat as well. But that round ligament pain will often present as a sharp stabbing pain that women will describe, and they'll kind of point like to the inside of their pelvic bones. And they'll say it just randomly happens. And they will describe it. If you have a pain scale of 0, meaning no pain, to 10, meaning the worst pain you've ever felt, they will describe it as a 10, but it's like instantaneously sharp like a knife. When you have constipation and gas pain, that can be more bubbly and intermittent, but it won't usually be described that way. And a lot of the constipation will be very dull. And then finally, if you're talking about appendicitis, it's usually on the severe side, but it is constant and it does not go away. Okay. So thank you for that question. Let's go on to our next question, which is about blood pressure. So, hello, I'm 32 and I want to become pregnant. I've been on 5 milligrams of Antibiotic since I was 29 for high blood pressure, which they believe is genetic. Would it still be safe for me to get pregnant and have a baby? I don't want to die, but I want to have a baby. Okay, so this is a complicated question, but it's a good question. So the first thing I need to tell you is Antibiotic is not something we use in my country. So I am not able to tell you whether that is safe for pregnancy. So this highlights that sometimes you're going to have questions about a medication. You may trust your healthcare provider implicitly, but you still want a second opinion. Another place to go for a second opinion is your local pharmacist. Pharmacists have extensive training on medication and how safe they are. So I cannot tell you whether this specific medication is safe for pregnancy. But in general, there are many medications that can be used for high blood pressure that are safe during pregnancy. So what you want to do is, if you're thinking about becoming pregnant, you may want to ask if you can see a maternal fetal medicine physician. Maternal fetal medicine physicians are the doctors that handle high-risk pregnancies. They are the specialists, and they know all the medications and treatments for the conditions that complicate pregnancy, like high blood pressure. They're the ones that may be able to guide your treatment and help decide what medications will work best for you. It's probably important that if you are planning on getting pregnant, that you also see a cardiologist to see how well your heart is functioning and to get an echocardiogram, which is an ultrasound of your heart, which can look to see if the valves are in place and if everything's flowing right, because these are all very important for your pregnancy. When we get pregnant, there's extra strain that's put on our heart due to a higher blood volume to support your baby. So I think it's fabulous that you are looking at this ahead of time and thinking about this. And there are definitely some things that can be looked at for this. Thank you for that. Hi, Saba. I saw your question before, and I am going to tell you about that right now. Thank you for putting it into the chat. So the question she has is, what about Cipralex during pregnancy? So Cipralex is a medication that is used to treat depression and anxiety. In the United States, we call it escitalopram, spelled ESC, or Lexapro. Lexapro is one of the safest medications that you can use during pregnancy. It actually can also be used for breastfeeding. One of the things that we tell moms is we want to make sure it's being dosed at a dose that works best for them. You don't want to be just tolerating, you want to feel very good. 10 milligrams is completely safe. That's actually a fairly low dose for this medication. Now, the only thing you want to know about Cipralex, it depends on how far along you are in your pregnancy. So when you are further along in your pregnancy, there is one risk with SSRIs. So SSRIs are serotonin selective reuptake inhibitors. This is the category of medications that this Cipralex is in. They increase serotonin. Your baby is getting little teeny tiny doses of serotonin through the placenta right now. When you give birth, the baby is no longer going to be connected to that placenta, and immediately the baby's going to be cut off from that extra serotonin. This can create what's called withdrawal syndrome. Now, that sounds really scary, but it's not nearly as scary as you might think it is. So withdrawal syndrome from serotonin is a baby who can be more irritable. The baby may cry a little bit more. The baby may want to be held a little bit more. Babies are sometimes a little bit more difficult to feed. And this is because they don't feel good. If you were to just stop your Lexapro right now, you wouldn't feel good for a couple days. But it's only a couple days. Same thing happens for baby. It's only a couple days, and then those symptoms resolve. One of the best treatments for that is to actually breastfeed, because your breast milk will also contain small amounts of the Lexapro, which will help wean baby off, because baby will get little teeny tiny doses. Now, the other thing you can talk to your healthcare provider about is possibly weaning off the Lexapro during the last 4 weeks of your pregnancy and restarting it as soon as you give birth in the hospital, okay? Now, this needs to be weighed pros and cons, because if that Lexapro is like seriously saving your life, stay on it, okay? The baby will be fine. You just give lots of cuddles, lots of skin to skin, feed as often as you can, maybe use a pacifier, things will be okay. But if you've been stable on this for a long, long time and a couple weeks off won't severely impact your health, or if reducing it even to 5 milligrams for a couple weeks will work for you, this may help minimize some of those symptoms in your baby. So I hope that helps. So lichen sclerosis could just happen to anybody as far as itching. Most likely you'd need to see a dermatologist, and they would give probably like topical hydrocortisone. But the most common cause of severe itching is cholestasis during pregnancy. You're so welcome, Saba. You're so welcome. So cholestasis is where you basically have a buildup of bile and bilirubin in your blood, and that can lead to organ failure. And most women with cholestasis of pregnancy will end up having a induction and delivering early, because it can be life-threatening for mom and for baby. And we actually have a video on that, cholestasis during pregnancy, and we'll link that into the description. And unfortunately for cholestasis, the other thing with that is there's no treatment. You just have to wait for delivery to happen. Our next question is actually, it's a really good one. We haven't answered anything about this before. It's carpal tunnel syndrome. So I am 27 weeks pregnant, and I have had severe carpal tunnel on both hands since I started my second trimester. I noticed 2 weeks ago that on my right hand, my middle and ring finger have been feeling like they're getting locked when I try to close and open my hands. A couple days ago, I noticed on my left dominant hand, my middle finger is getting locked again. My OB and family doctor said they can't do anything until I deliver. In the meantime, just Tylenol. But that doesn't help at all. I'm really in pain all day and can't sleep at all. My pain and discomfort already run to my elbows and shoulders. So this is very, very unfortunate and it really sucks. And unfortunately, carpal tunnel syndrome is very, very common during pregnancy. So there's a couple of things that I'm going to tell you. The first thing is that I would recommend that you actually go to a hand doctor, that like a hand surgeon that treats carpal tunnel syndrome. So they are not going to do surgery on you while you are pregnant unless they absolutely have to. Like, there's no other option. You became paralyzed or something. Other than that, your OB and your family doctor are correct that there's not a lot they're going to do. But a carpal tunnel surgeon or a hand surgeon may have some help for you. So one of the most common treatments is bracing. There are very special, specific braces that can be used to help alleviate carpal tunnel. What often happens that I find is not very effective is that OBs and family doctors will say, use a hand brace, and they just send you into the pharmacy to go grab one for yourself. But that's actually not very helpful because some of those braces will actually put pressure on the carpal space, okay? And what's happening is there's swelling in there that's pinching on nerves. So you want to make sure that you're using the right brace, okay? So I would go to those hand surgeons because even though they're not going to do surgery on you right now, they know the best braces. They may also be able to do some testing to determine which brace is better. And finally, if your carpal tunnel does not resolve after you give birth, you are already in with a specialist who can perform the surgery as soon as possible. And usually it's a little tiny cut here, and they cut the carpal ligament to help release some, put some space into that area. Now, one of the other things that you can talk to your healthcare provider, and you may need to actually, find the maternal fetal medicine physician, is you could ask if you are eligible to take low dose Cymbalta. So Cymbalta can be used for nerve pain. And so that's one of the things that they may or may not be able to consider. The other thing I would tell you is to make sure you're using ice. Ice helps with inflammation, and make sure you're using a lot of positioning, like at night when you sleep, position with pillows for your hands. And then also make sure that everything's ergonomically correct. So when you're using typewriters and stuff, you don't want to be laying your hand against a desk like this, right? Because that's going to push on that space and it's going to make it hurt more. You want to make sure you're giving your arms and your hands a chance to rest and stuff during the day. Unfortunately, a lot of us work computer jobs and that doesn't help with the situation. We do have a carpal tunnel video. I hope you've watched it. And, it's just, unfortunately, it's a really, really challenging thing to deal with during pregnancy. Okay. I see we have a question about HIV and pregnancy. Not sure what you want to know. So can you ask a little bit more about that? And for anybody else who's joining us, please remember to feel free to type any questions into the chat. I'm Dr. Samantha, the maternity mentor. So welcome, welcome. Our next question is about cesarean sections. Is fever normal or is it something I need to be worried about? So if this question is referring to after your C-section, is getting a fever normal? That is not normal. Okay. So a fever is a sign of infection. After you've had major surgery, you should not be developing an infection. Most cesarean sections, they actually give you IV antibiotics while you're in the operating room to help prevent this from happening. So if you get a fever, you need to contact your healthcare provider immediately so they can go ahead and they can check you out, do some blood work, and make sure that everything is okay. You're most likely going to be given some antibiotics. You want to make sure if you are breastfeeding that you check with somebody to make sure those antibiotics are safe for a baby while breastfeeding. So pregnant women, back to the HIV question. If a pregnant woman is diagnosed with HIV during her pregnancy, they usually want to give her the antiviral medication. It's basically almost the same treatment as when you're like not pregnant. There's very few differences. The biggest difference is when she goes to deliver. They do want to give a bolus dose of certain medications, and these have honestly been changing. So I'm not going to give any names because it depends on the country. It even can sometimes depend on the region, and the protocols have been changing as research continues to develop. But what they do want to do is they want to check mom's T cell count. If it is too high, they go ahead and they do a C-section. But if not, it is recommended for a mother to deliver vaginally because this gives the least amount of chance for the baby to develop HIV. Post-delivery, at least in our country, in my state, the baby is tested for HIV and immediately, like within hours of birth, started on antiviral medication that will be continued for a certain amount of time. And usually, I think right now it's a 3-med protocol. But again, HIV is very, very tricky. And so it just depends on where you're at, to be honest. And I'll even tell you, which is an interesting thing, HIV and breastfeeding also changes depending on what part of the world that you're from. So it's a moving thing. All right, so our next question is about pelvic pain. And I do have, again, that link in the description for the pelvic pain video. Is it normal to feel pelvic pains while 14 weeks pregnant? And will this pain go on for the rest of my pregnancy, or is it a sign of early labor? So honestly, this is very hard to answer because it really depends on what type of pain and what causes it. So what I'm going to say is that this is a mom who should contact her healthcare provider. If you have pain is not normal, and you need to make sure you contact your healthcare provider so they can assess you, to check you. Usually they're going to want to actually look at you. They're probably going to want to do blood work to rule out infection, and they're probably going to want to do an ultrasound to see what's going on inside the belly. Okay? But unless you've been diagnosed with something that causes pain, like round ligament pain, you want to be asking them to check things out. I think you're asking, does the baby need medication after delivery for HIV? And the answer is yes, 100%. What they've shown with research right now is that babies that are exposed to HIV in the womb, if they're given antiviral medication for a certain amount of time, they may not develop HIV. Okay, they may become HIV negative. All right, so postpartum hemorrhage. I was concerned about how much I was bleeding and had frequently called the doctor to ask about the bleeding and pain. They kept telling me all was normal till 4 weeks later when blood clots the size of organs were falling out of me. I was rushed to the hospital when my heart stopped. I needed 5 units of blood and almost didn't survive. I still have trauma 4 years later and will never likely conceive again. All of this because of an undiagnosed retained placenta. For 4 weeks, I felt and feel severely mistreated and neglected by my doctors. So this is a very sad situation, and postpartum hemorrhage is one of the most traumatic things that I've seen happen during deliveries. And honestly, many families who come to see me after the fact for depression and anxiety and PTSD, this is usually the cause. So postpartum hemorrhage, you're bleeding to death, okay? And it happens all of a sudden, and it's just like one of those horror movies where blood just goes and goes and goes. And what happens is a whole bunch of people rush in, and they're just doing everything that they can to try and save you. In her case, she went home and didn't realize what was going on. So let's talk about the bleeding again. Is bleeding normal after delivery? Absolutely. Bright red is normal. It's normal for even a week or two. But what's not normal is pain inside the vagina, okay? Pain inside is a sign that something's wrong. Now, for those of you who give birth and go to breastfeed, there is a potential signal that you may have a retained placenta. If a mom is trying to breastfeed after birth, and after, say, 4 to 6 days, her milk isn't coming in, despite her offering the breast a lot, despite her pumping exactly as she should, despite her doing everything, her milk is still colostrum. We as lactation consultants will say, what does your bleeding look like? Are you still bleeding heavy? Are you like expressing clots? If she says yes, we call her OB and we say, we think she has a retained placenta. You need to do an ultrasound. So one of the causes of not being able to produce milk after delivery is having a retained placenta. The placenta is the organ that attaches to the uterine wall to help feed your baby. All of it should come out after you give birth, but sometimes a little tiny piece stays in there. Now, your body does not get the signal to make milk without certain hormones, and those hormones don't start to be produced until every single piece of the placenta comes off. So if that doesn't come off, it's not going to happen. Now, the other thing is your entire uterine wall, this area where this placenta was sitting, it's all open blood vessels, okay? So everything needs to come off so that it can close up tight against those blood vessels and they basically clot off. That's just like when you get cut and the bleeding stops on its own. It clots off, okay? So if there's a little piece that's preventing it from curling up and clotting off, you're going to continue to bleed and bleed and bleed. Okay. Now, our bodies do make blood for us. Okay. It's constantly making blood, but not at the rate that this bleeding will occur because some of these blood vessels, they're big. Okay. Now, what are some of the other signs? Because this mom was saying she had pain and she was bleeding a lot, but what are some other warning signs that you might be having an issue? If your heart is racing. So as our blood volume drops, our heart needs to pump faster and faster to get what blood we have going around our body. So you may feel like flutters in your chest, or your chest just, it feels like it's constantly pounding. Another thing is a headache, a throbbing headache. So remember, your brain is one of the most important organs you have, and it gets fed by blood. But as your volume decreases, that's the amount of blood you have, gravity is pulling the blood to your feet. So your body has to work extra hard to bring the blood up to the brain. And since there's not a lot of it, it will feel like throbbing because it's pumping really hard to get up there. So a lot of women will describe a throbbing headache, okay? Now, another thing that you might experience is extreme fatigue, okay? Like you can't keep your eyes open. You slept for 12 hours and you still can't stay awake. That's because your blood carries your oxygen. And so as you're depleted in blood, you're not getting enough oxygen, and that makes you feel tired, okay? If you are not sure and you are bleeding, go to the hospital. Go to the hospital, get checked out. It's extremely important for you to make sure that you are okay, because hemorrhage is one of the leading causes of death after you give birth. In fact, it's usually the number one cause of death after you give birth. When you go to the hospital, make sure they do an ultrasound. Ultrasound is one of the most definitive ways that you can see whether there's a piece of retained placenta. Even if there's not a piece of placenta in there, you can hemorrhage for other reasons. And going to the hospital and insisting on being checked out, hopefully they will give you some fluids and maybe even some blood to help stop this, okay? And the last thing I'm going to say about all of this is that this mom mentions trauma. Childbirth is a very big moment in our lives. It's often very joyful, but not all the time. And sometimes things are traumatic to one partner and not the other, and they can be little things. So for example, sometimes moms will get what's called an episiotomy. This is where the baby's coming out of the vagina, and the perineum, which is the bottom, the piece of skin between the vagina and the anus, well, sometimes we need to cut that. That sometimes happens if the baby is not coming out fast enough and we think there's a medical emergency. That episiotomy can be extremely traumatic for both moms and partners. There are partners who have actually come in because they remember that and they can't believe what that looked like for them and what that felt like for their partner and stuff. For women who didn't want an episiotomy, they can feel violated, and it's very distressful. And these things can lead to PTSD, and PTSD can interfere with bonding with the baby. So don't feel silly if you feel like things were very upsetting for you in your birth. You want to go and talk to a counselor and, just explore those feelings and work through it. It's trauma therapy, and it can be good for you. So the next question is, there's a yeast infection question. So the yeast has spread to my daughter's face. Any tips on how to take care of her skin? So for babies, it's very hard to take care of yeast. And I would say that it's a little complicated, because if the baby's got yeast from an oral yeast infection due to yeast on the breast, obviously the first thing we need to do is take care of the yeast infection altogether. Okay. So when mom has a yeast infection, she usually gets like deep stabbing pains and itchiness. Okay. And babies' mouths will often be coated with this like white coating because they have the yeast infection. If we treat mom and not baby, they're just going to pass it back and forth between the two of them. So if baby hasn't been treated for the oral yeast, you can't really work on the face either. So I would tell you the most common treatment for babies is nystatin. You would need to ask your pediatrician, but they may be able to use nystatin on the face as well. But don't do that without following your pediatrician's advice. Now, the other thing is, a common thing that we often see people do is like antifungal creams like clometrazole, miconazole, ketoconazole. You cannot use those on your baby's skin. Let me repeat that. You cannot use those on your baby's skin. Your baby may be able to use the same types of medication, but it would be at a very different dose for a baby versus an adult. So don't just use a antifungal cream because you have it. You want to talk to the pediatrician. All right. Our last question that I have here from viewers this week is also about yeast. I'm not sure if it's thrush, but I do feel itchy, and my vulva is very sensitive to scratching. It gets swollen and cracks open pretty fast. If I wash my vulva with water instead of scratching every time it feels itchy, the itchiness subsides. Washing the vulva often and not wearing underwear keeps the itchiness away, and I feel all right. So this is a very good question, and I really, really like this. So yeast infections of the vagina. So the first thing is you need to confirm if this is a yeast infection. And the way to do that is to go to your healthcare provider, and they'll take a sterile cotton swab and they'll swab the area and they send it to a lab and they test to see what the secretions are. Yeast infections of the vagina and should have like a discharge associated with them. And it's usually white and creamy and sometimes looks like cottage cheese. There are other infections that can cause you to be itchy in the vagina, which is why it's important for you to get tested. Because if this is a bacterial infection, that can be easily treated with antibiotics. Now, the washing of the vulva with water is a very good thing to do. However, if you do it in excess, it may actually be drying out the tissue and making things worse, which is why it's important to get treated properly. For most things, going without underwear as much as possible is actually really good for vaginal health. Because the vagina is very moist and dark, so it encourages growth of bacteria and yeast. So when you leave it open to air and let it dry out, it actually will help reduce that and help you feel better. You want to just talk to your healthcare provider and see if they can test you, because there's a lot of anti-yeast medications that may help with this. Okay. You do not want to douche. Okay. Douching is a type of solution that women will often use. They insert a little tube inside the vagina. They squirt. It releases this solution, which is like a cleaning solution, and it helps to clean out bacteria and stuff. Douching is actually very bad for you and can actually promote yeast. A lot of women think this is very healthy, but it's actually not very healthy for women to use. Okay. All right. I see we have another question. in the chat. Hi, Rubina. So I am on the 22nd week, and hold on, let me see this. So she thought you might have chronic placental abruption because you had 2 spotting episodes at 17 weeks and 20 weeks for 1 day with cramping. Anomaly scan is normal. But she said we don't have any way to confirm this and asked for bed rest for at least 2 months. Okay. All right. So this is very good. Okay. So what she's saying, if I'm understanding this correctly, is she is 22 weeks pregnant right now. So she's getting very close to the, being at the what we call the age of viability, which is where a baby can potentially, with a lot of medical intervention, live outside of the womb. At 17 weeks and 20 weeks, she had bleeding for 1 day. So what she did was she called her healthcare provider and they did an ultrasound, which is exactly what should be done. And what they're saying is they think it's a subchorionic hemorrhage, but they're not sure. So a placental abruption. I'm sorry. So uterus is attached to the wall. An abruption is where the uterus separates from the uterine wall. Okay. Now, sometimes a little teeny tiny piece. Okay. So this organ is big. It's like big like this when it comes out. So if the whole thing comes off, that's like a medical emergency and mom and baby can pass away very quickly. But sometimes the little teeniest, tiniest piece comes off and that will cause a little bit of bleeding. But the thing is, once it happens, it's done and you can't tell on ultrasound. It's just so small that it's just never going to be seen. So the only thing they can do is if they don't see a cervical tear, which is the tear of the cervix, which is at the bottom of the uterus, if they don't see an issue with the baby or an issue with the amniotic sac, if they don't see a big placental abruption, if they don't see a subchorionic hemorrhage, and we have a video on subchorionic hemorrhage that we can link into the chat. That's basically almost like a pocket of blood underneath the placenta. They can only surmise or guess that this was a slight placental abruption. And they will be able to confirm that once you deliver the baby. They'll look at the placenta and they will check to see if they see signs of that. So bed rest for at least 2 months. What should I do in this case? So we actually have a video on bed rest. So I want you to check that out. But if she's saying bed rest for 2 months, that's because she's not sure what's causing it. So she wants to make sure you have a lot of rest on your body to make sure nothing else happens with the placenta. What should you ask her? You want to ask her what bed rest really means for you. Okay. So a lot of women take bed rest to mean that's it. Like they're in bed 24 hours a day. They get up to pee. That's it. And some women need that. So some women need to even get what's called a portable potty or a portable toilet that sits right next to their bed. And they literally can only get up to go to that bathroom and lay back down. And some women are even advised to prop to prop their hips up so their head is actually lower. My guess is you don't need that. Now, some women are able to get up and walk around their house to make light snacks, but they need to be in bed or on the couch for most, like 80 to 90% of their day. So you want to ask, what does this actually look like? Am I allowed to go to the store? Can I go to the store in a wheelchair? Am I allowed to sit on my couch? Can I only lay on my couch? Okay. Am I allowed to take a shower? So another thing with bed rest that people take for granted is, are you allowed to take a shower? Because most of the time showering means you're standing up. And so when you're standing in the shower, you're not doing bed rest. And heat from the shower can actually stimulate some contractions. So can you take a hot shower? Can you take a cold shower? How often? How many times a week can you shower? All right. And then 2 months sounds good. But you want to make sure if you really truly are on true bed rest, you want to go ahead and you want to get something called an incentive spirometer. So an incentive spirometer can be found online. They're easy. Like I know you can get them on Amazon. Depending on where you are, you might be able to get it at your local pharmacy. This is like a device that what you do is that you kind of take a couple breaths, you put this tube in your mouth and you breathe in, okay? Right? And the idea is when you breathe in, you're expanding your lungs, you're making them bigger. And this little dial on the incentive spirometer goes up. And you're supposed to do this when you're in bed 10 times an hour. Why? Because if you're doing bed rest, you're at high risk for pneumonia. Okay. So you want to make sure that you're expanding those lungs, because the more you expand them, the less likely you are to get pneumonia. Okay. Now, the other thing that you're going to be at high risk for is blood clots. So you want to ask your doctor about whether you should be wearing compression stockings, which are these tight socks that help promote circulation. And you also want to be doing some exercises, ankle rolls, bending at the knees to try to move that blood around, and so that you can prevent that. And you also want to make sure that you go ahead and you walk around if you're allowed to walk around, because that can help with preventing blood clots as well. So I definitely hope that helps. Okay. I don't think we have any further questions. If you guys have any questions, please feel free to put them in the chat. I'm Dr. Samantha. I'm a board certified psychiatric nurse practitioner who's been a lactation consultant for over a decade now. So I do a lot of work with breastfeeding women and pregnant women who need help with depression and anxiety. I also specialize in taking care of fathers who develop postpartum depression, because fathers do develop postpartum depression as well. I want to make sure that you guys are checking out the channel because we have lots of new content all the time going on up there. And, just ask your questions. We are doing our lives as much as we can on Mondays at 9 p.m. Eastern Standard Time here in the United States. And this is an opportunity for you to ask any questions that you might have currently. I'm just waiting to see if anything else comes into the chat right now. And we are putting in some links for an incentive spirometer that you can look at. So hopefully that will help you out with that. And I think that is it for tonight. Thank you so much for joining us. And remember to like and subscribe. Have a good evening, guys. Thank you.